Hi, welcome to OLA 2020. Thank you so much for joining us in this session called Social Services in Public Libraries. Yes, you need them. My name is Brittany Mays, and I'm the chair of the new Equity, Diversity, Inclusion, and Intellectual Freedom Committee this year, and I'm so happy to moderate the session. I think it's a very important topic. I am joined today by our session's presenters. We have Sue-Ann Weimer, Wendy Nordlinger, and Greer Feitz. When Sue-Ann Weimer helped to initiate and has coordinated Tulsa City County Library's case manager at the Library Service since its inception in 2012. She's held many public and non-public positions at TCCL. Sue-Ann currently manages the library's Youth Services Department, helping to coordinate system-wide services for youth, their parents, and their caregivers and educators. Wendy Nordlinger currently works as a consultant and continuing education coordinator for the Oklahoma Department of Libraries. Wendy has worked in libraries for 20 years, including 10 years at the Metropolitan Library System. If she's not at work, you can find her digging in her yard or running and biking with friends. Greer Feitz is a licensed social worker with over 40 years of experience. She was instrumental in establishing the collaborative partnership between Family and Children's Services and the Tulsa City County Library System. This program is especially dear to her, as her father was a librarian at Northeastern State University in Tahlequah for many years. Now I'm going to turn the session over to our presenters. I'll be back at the end with some questions. We're going to start with Wendy. Wendy, take it away.
Hey guys, welcome. Thanks for tuning in to this webinar. This is something that's very important to me as well. This, I will also say, is just the beginning. I'm hoping to do much more around the state, encouraging libraries to engage in social services. So be looking for more things on the horizon. As far as today, I'm going to do my best, along with my two presenters, to provide information, examples, and resources for all of you as to why you should have social services in your libraries, and examples of how this is being done in other libraries, including TCCL. And I think they'll probably do most of the talking, but I am going to give you an introduction. And so we go to the next slide. So just a little background here. There are 119 libraries, public libraries in Oklahoma, with 13.41 million visits to public libraries in Oklahoma each year. 1.98 million registered cardholders. At the same time, we're seeing 3,944 people experiencing homelessness in Oklahoma, and we're only seeing 3 public libraries offering some level of social services in their library. And next slide, please. So, why social services? Every day there are numbers of people with unmet needs, poverty, homelessness, mental health, substance abuse, and these people are in your library. You know, when we're looking at the statistics, we, often see homelessness, but it's not just the homeless that are visiting your libraries. It's people with all kinds of unmet needs. Especially libraries in low-income neighborhoods, in central cities, or maybe rural communities. Looking at public libraries, studies have found that public library staff recognize that they are well-positioned to assist library users who are experiencing homelessness or other unmet needs, but that library staff are not trained to address the specific and often complex needs of this population. So although they are in communication with these people every day, they don't necessarily have the tools or the skills in order to help them. So by offering social services as a part of your library experience, you're able to connect with the most vulnerable citizens with information and resources. So what are the most common unmet needs of those customers coming into your library? We're looking at housing, unemployment, financial needs, mental health, substance abuse, and medical or other health-related needs. And often, when people are experiencing these unmet needs, it just takes one incident for them to experience a crisis, a loss of housing, missing one paycheck. Most of these people are possibly living paycheck to paycheck, and this could be the tipping point to an incident. So when we are looking then, why and how do we connect social services and public libraries? Why is this a great partnership? The expertise and training and working with at-risk individuals that our social workers have, the knowledge and awareness of specific community resources, their ability to connect at-risk individuals with community resources is a way, they can do this in ways that often library staff cannot. So public libraries have long understood that there is an advantage to working hand in hand with other local agencies and provide amenities similar to those offered through the library, like social services. In addition to being an effective way to dispense service and aid, also helps to reduce a redundancy of services. Next slide. Libraries are addressing the situation with creative and practical solutions. These are some areas where we can see social services being introduced into libraries. We have social workers, we can use student interns, public health workers, peer navigators, and case managers. That is the basic introduction from me as far as why and how we might try to integrate social services into our libraries. And now I'm going to hand it over to Sue Ann, who can talk to you guys a little about the TCCL experience.
Next slide. A strength of public libraries, as Wendy said, is our willingness to partner with other community agencies to provide library users with needed services. Tulsa City County Library has partnered with Family and Children's Services of Tulsa for almost 8 years to provide the expertise of a case manager who works directly with library users and library staff. The case manager supports the library by serving adults who are homeless, mentally ill, or exhibiting behavioral issues, and through training to improve the skills and confidence of library staff who regularly work with this client base. Next slide. As with most new services, especially one that required strong funding and a staffing component, the case manager program started with a short-term pilot, and over a year's ease at 20 hours a week at Central Library, we hit our stride in 2014 with a full 40-hour-a-week case manager dedicated to serving library customers and staff throughout the system. The program is funded through a grant from a local foundation, and as an employee of Family and Children's Services, the case manager attends weekly staff meetings of the outreach team. She participates in required training to maintain various certifications that Family and Children's Services manages for her. And she has access to and knowledge of a vast array of local resources and services benefiting vulnerable individuals. Next slide, please. The case manager position continues to help move the library from a reactive position to a proactive service that recognizes the needs of vulnerable individual library users and offers a targeted source of assistance beyond traditional library services. The program goals have been fairly settled since we started the program. And in reviewing these goals, you may notice the emphasis is on changing the behaviors and knowledge of library staff in order to improve library services. By increasing the staff's knowledge and skills, library customers benefit from a more welcoming and receptive library experience. So TCCL has 24 locations, which means our case manager is spread pretty thin. But over time, we've learned at which locations there are more likely to be library users who would want to take advantage of her services. And so our schedule is eventually focused on branches where the need is greatest. However, this set of goals is for the whole system. The case manager is available to consult with library staff throughout the system, make appointments to meet with customers at the branch location that's most convenient for that individual, and to provide aid via telephone calls with library customers, and to consult with library managers and staff. We put a lot of effort into making sure library staff throughout our system, both public and non-public employees, are aware of the case manager service and know our case manager. Next slide, please. So it'll be no surprise to the folks in the audience that in 2013, the very first year we offered the case manager service, we developed a method of tracking levels of engagement by the case manager when working with library users. So data gathering, no surprise. And as a grant-funded program, it really was necessary that we gather data and that our data gathering methods were consistent. So the categories you see here are from 2013, and based on what the library knew folks were already asking about. We also got feedback from the library security team, the frontline staff, and we worked on this hand in hand with Family and Children's Services, who were aware that there might be areas that the library had never engaged with customers, but a case manager might. So the case manager tracks engagement by the number of hours spent in each of these categories of service and at which branch location. So we have a lot of ways we can look at the data and analyze what's going on. When we first started, I thought that our incident reports would decrease by having a case manager. But over the first couple of years, our incident reports actually increased. So in looking at the data and talking with people, we determined that in part, the staff became more knowledgeable as they became more confident in working with users. They were actually tracking incident reports much better. While Deborah, who is our case manager, is able to engage in different ways with library customers, connecting them with community resources, she is also knowledgeable about library materials and resources. So if a homeless individual comes in seeking information about housing, the first question Deborah asks is, do you have a library card? If they don't have a library card, she knows exactly how to walk them through to get one. If they don't have an email, she knows how to walk them through to get them an email address. She knows across our library system where there's expertise in staff, where there are resources, where bus stops are. So she's able to actually engage with customers not only based on her knowledge of social services, but also what the library can offer. Next slide, please. A strategic opportunity of this program also provides an expert level training of library staff in areas outside our traditional services. Most public library staff aren't trained to deal with people in crisis situations, and often new staff have never worked in an environment where there may, say, be a pattern of homelessness among its users. So it's become the role of library social workers, library case managers, to also help train staff in how to best help customers in need of those social services or perhaps in mental distress. Training delivered by TCCL's case manager aims to provide library staff with the confidence to assist customers who exhibit behavioral issues. Our primary training points are to recognize that everyone is different, so focus on what works best for the person standing right in front of you right then. Listen attentively ask questions, understand body language and facial expressions, especially in context of the current interaction, and to empathize with the customer and consider if your roles were reversed, how would you want to be treated? So what we have listed here are areas where staff should be knowledgeable about working with anyone using their library. I also recognize that not everyone has access to a Deborah, who we have. So she performed a little research project and looked for online and free resources that would be good for staff training and staff knowledge that you all might use. She located a multitude of articles, videos that are posted on YouTube, state agencies and other resources with learning materials. And for a list of those resources, you can visit the ODL Social Services site, and Wendy will talk about that a little bit later. Next slide. So TCCL's Case Manager program is fundamental to the library and to our mission. The program helps to ensure the library is a safe and welcoming place for all. And now passing it over to Greer.
Thank you, Sue Ann. Early in my career, I noticed the similarities between social workers and librarians. And that similarity is the fact that we're trying to connect our clients, our patrons with resources. I can remember seeing the happiness in my father's face as he worked as a librarian at Northeastern when he was working with a student and being able to connect them with what it is they needed to complete their project. The same kind of thing happens for social workers when they're working with a client who has a specific need, and we can connect them with the services that will make things better for them. So next slide, please. Each community is unique. I think we all know that. But who are the primary users of your library? That may be a place to start with determining how to connect with social service providers in your community. Is there a particular population or a particular need that is very apparent within the library? Recognizing those things can lead to becoming more familiar with what community agencies you have. Learning and knowing about the agencies that exist in your community can help make that connection. Those agencies could be nonprofit groups, could even be volunteer groups, and particularly could be state agencies, state-operated agencies. Developing a relationship with those agencies can help bring the services into your library. And important in doing that is identifying a person at that agency that you can connect with and a particular person at the library who can act as that liaison. Ideally, a community could find a worker who is generalist enough to be able to cover the whole range of social services. And hopefully an agency or a person can be found who could do that. And especially because homelessness is such an issue in our state, and particularly we've seen this in Tulsa, but I know it's not unique to Tulsa, that homelessness is such an issue of those individuals finding their way to libraries. Learning who the homeless provider in your community is an essential thing. State-operated agencies can be a huge asset here as well, particularly, I believe, the Department of Mental Health and Substance Abuse Services. Next slide, please. Then this slide shows the coverage for the state of community mental health centers. All 77 counties have a community mental health center that serves it, and all community mental health centers have an outreach component to the services that they do. Now, this outreach can take many forms, and of course, there are limited resources to a state agency. So a center may not be able to devote a staff member to your library, especially in more rural areas that are covering a large geographic area. But they are available perhaps to do things like training and consultation to your library staff. Centers also provide crisis response and an array of other services that can be valuable to a library. So I believe that this is a very important connection for every community. Each center operates according to how they see the needs of a community. So I would certainly recommend that you let your center know what your needs are and develop that relationship. An additional service that the Department of Mental Health and Substance Abuse Services has is the training of law enforcement officers. Since this program has been in operation since 2002, and during that time, they have trained representatives from 27 county sheriff's offices, 95 police departments, 6 tribal nations, and 3 universities. They are open to invitation for further training. So I think that's just an important thing to know if you see an opportunity for that in your community. Next slide. So finding a specific social worker for you. Again, the local nonprofits and state-funded agencies are opportunities. Here I listed just youth services and senior services to show the span and the array of what services are there. And on a future slide, we'll look at more options for what kinds of nonprofits could be an asset to your agency. Local universities are also a tremendous resource for libraries. There are a number of universities across the state that have a School of Social Work. Next slide will show the list of where those universities are that have a School of Social Work. Some have bachelor's programs, some have bachelor's and master's programs. You can see by the list of schools here that they are expanded across the state. And part of every social work curriculum is that students do a practicum, which is a hands-on, face-to-face interaction to prepare them for their career. Practicums are required from every student, and they can do these anywhere within the state. Those practicums don't have to be performed within the city where they have gone to school. And a lot of creative thinking has gone on to connect students with practicum opportunities. Several universities are offering online schooling now as well, which means that someone can be sitting hundreds of miles away from where their university is located and still be getting their degree. I've seen a number of examples of a student being very creative with their local community, with their hometown, in order to create that practicum opportunity. So this is a real opportunity for a library to connect with someone who could serve as a social worker for you. Next slide. So there are a number of options of how to obtain a social worker. They could be hired, contracted, or be a student. And there are pros and cons to each approach. A hired social worker then becomes an employee of the library, which means the library has more control over that person. But the social worker also has less connection to the community by not being a part of another system, and less connection with their profession. Contracted is my strong preference. Of course, that's because it's what I'm experiencing now. But in addition to that, with the employee being part of a partner agency, it keeps the worker tied to the larger community. In particular, it provides supervision for that person from someone of the same profession. They also get consultation, collaboration, the opportunity for an easier exchange of information with their colleagues and peers. The third opportunity is, again, for a student. And I've seen this has worked in a number of communities. A positive for the library is that there's no cost involved, there's no salary. Students, though, are in a learning mode, so they are not as independent and not as personally knowledgeable or experienced as a professional. There would be turnover with the semester, at least on a semester basis, and well, perhaps on a yearly basis, but at least every semester or so, there would be a change up in who that person would be. So if this option is taken, it's important to have a connection with the university, with the professor who serves as their supervisor. And I would encourage that the library be a part of the interview process for any student who comes that way, to assure that it's a good fit, that there's consistent hours, and that there's open communication. Next slide. The National Association of Social Workers is the professional organization for our profession. It, in conjunction with the Public Library Association, has a library task force. The link is here at the bottom of the slide. There's not a lot of information about it on the website, but there is a lot of contact information for individuals who are on that task force if you'd like to pursue that. And my last slide is next. Here's a further list of more community partners, agencies within the community to consider making a connection with. As you can see, there's a wide range of options, and it really depends on the community's resources and dynamics. I would just say that allies can be found in unexpected places. Getting the discussion started may lead to interested parties that were totally unexpected. And that is the end of my section of the presentation.
Next slide, please. If you're developing a formal partnership with another agency or a university, it's really a best practice to have a written and signed agreement noting the expectations of both entities, who's doing what, who's doing it when. But how detailed and formal that agreement is really depends on the level of service or the exchange of services that you're developing. If you are bringing in a student intern, then the university is going to have for their practicum, the university is going to have paperwork that is going to formalize that agreement. If there are financial considerations that should be included with your partnership, then you need to include those. So, for example, if the partner agency that holds the grant that's underwriting your partnership, you should make sure you know who's producing reports back to that funder, who's submitting renewals for the grant if you're going to renew it. So originally, TCCL and Family and Children's Services for our case manager program, we didn't have a written agreement. It was just a conversation between the two organizations. But when the program moved to 40 hours a week, we drafted an agreement that included the purpose of the program, how and what services would be provided, the maintenance of privacy of the case manager notes and reports, because as an employee of Family and Children's Services, they actually have requirements of confidentiality with their clients. We also noted what reports each agency would deliver and under what terms the partnership might be terminated. Next slide, please. So funding opportunities, as Greer just mentioned, there are some free opportunities out there. If you have someone from, say, the police department come in to train your staff on recognizing if an individual's behavior indicates possible drug use, that's going to be free. IMSA comes in to do the training. If one of the agencies, folks from another agency comes in to do a single training, that's going to be free. Before we even started, TCCL even started its case manager partnership with Family and Children's Services. I knew Greer from Leadership Tulsa, and I invited her to come and train some members of our research team. We had a lot of homeless individuals using the library. There were a lot of behavior issues, and staff really didn't know how to handle it. And so Greer came in and did about a 45-minute session with staff. It was great. It was wonderful. She did a few more. You may recognize her because she's done some workshops for ODL and OLA conferences. Those were part of her work experience. So Greer was free to come in and do those training sessions. So if we were to have someone come in, you would have someone come in and do regular and routine social services like the case manager program, then likely that is not going to come free. But there are a lot of areas that you can pursue that aren't going to come with a price tag. Grants and foundations. So good old research techniques are going to come into play here if you're looking for grant opportunities or funding from a foundation. who may be interested in underwriting social service activities in a public library, or they may be interested in underwriting it through a partner agency. There are 2 cooperating collections of a national program called the Foundation Center. There are 2 of those sites in Oklahoma, and they have a bevy of resources, information on grants and foundation research. So TCCL's Research Center at the Central Library is one of those sites, and the other site is the Oklahoma City University. I do know the Research Center site, which is called the Nonprofit Resource Center, has a lot of free resources you can get to through their website. There's also a great resource with a lot of free information that we'll get on the ODL Social Services website. It's called candide.org, CANDID.org. From this site, you can access a free version of GuideStar, for example, and a number of other resources that are credible. Don't just go out and do a Google search or search on Bing. You want to go into those resources like a GuideStar. That's what they're built for, to give information about funding opportunities. So your library or your partner agency budget. If you're working with schools of social work, as Greer discussed, to bring those students in to serve their practicum, the monetary of that is going to be on the student because they're paying for their semester's work. It's going to be on the university. So there are no costs to the library to have a student come in and work with you. Actually, there are costs. There's staff time. You need that staff time to make sure the program is set up and working. And don't assume it's going to come easy. Think about it. Sit down and make some lists. You're going to have someone who can regularly work with the student, make sure the schedule is working out. Publicity and promotion, you can't just be quiet about it. Making sure a physical setup that the student needs is set up during their schedule. Making sure library staff are conversant about the program and service that you're offering. It can be difficult to define the costs like that, but do make sure they're on your list of things to consider. Your partner agency may have access to state or federal grants or funding that you wouldn't have access to or know about. So why not be the partner with that agency? Why shouldn't the library be the partner? TCCL's pilot period with the case manager program came about because Family and Children's Services had a short-term grant that our service fit the parameters of the funding they had. So during the pilot, we were able to actually go to a potential funder with data and outcomes in support of embedding a Family and Children's Services case manager at the library. So funding, you all know, public libraries, we know, can be difficult and hard. It takes a little work, but it's well worth it to put the energy into looking for something that's going to support bringing that service to your library. And now back over to Wendy. Next slide.
The next slide is talking points and community stakeholders. I can't tell you how times I have heard from library directors in the state that my board members of my board never even come to the library. So when we're thinking about our community, it may be that if we're not telling our stakeholders what's happening, they don't know. The police, as Greer and Sue-Ann both mentioned earlier about your community partners, they might be having the same problems you are, but if you're not expressing what's happening at the library, they don't know how to help you. They don't know that you're also dealing with this, the same people that they are. I mean, we say public libraries, we connect users with services and resources to improve their lives and to enhance our communities. But not everybody knows that. So it is very important to connect and communicate with your community stakeholders. Although connecting people with information is maybe the core of our mission, we're still agents of social change, and we still provide free access to information, and that can also include our social services. Next slide. So, also, I'm not going to talk a lot about community stakeholders, but I will say that there will be a link on the website, and I will list out talking points and ideas for you to use for your community there that you can just reference anytime you want. So really, next slide, please. I think the bottom line of what we're trying to kind of express today is that social workers, social services, partnered with public libraries is a fantastic relationship. It helps library staff as well as our library patrons. And it's definitely a relationship that we all need to develop and foster as we move forward. It also helps library staff be more aware of how to apply holistic services for library users. And so training them in this partnership and working with agencies and working with their social worker and training them in these areas is vital. Next slide. So this is the website, and it's academy.okpls.org/social services. It's up and running. I'm continuing to work on it and add things to it, but as Sue Ann mentioned, Deborah provided a list of all kinds of wonderful articles, YouTube videos. They're all listed on the website. Lots of resources, and I will continue to put things on there if we have any grants available. So please check out that website after you've watched this, and hopefully you can find lots of great ideas and ways to get things started in your community and at your library. So unless Greer or Sue Ann have anything they want to add, I think we can, if there's any questions, maybe Brittany would like to ask some questions, or what do you guys think?
We're good for questions.
Yes.
Great. Thank you guys so much. Wendy, Greer, Sue Ann. This was a lot of really great information. I do have a few follow-up questions. I guess one to just kind of recap everything. You know, we're libraries, we're information professionals. Greer, you mentioned one of our great joys is connecting people with resources. So what is it about social services workers or social workers in libraries that can connect them to better resources than maybe we can?
Well, I think it's the background, it's the expertise that a social worker brings to that setting. I mean, that has been our field of study, has been a lot of that has been around resource connection, as well as about the human interaction. I think a real value can be that social workers can do the social work stuff. It really frees up librarians to do the activities that librarians are trained to do. That we can each be, so to speak, in our lane. Because I do think, I mean, early on in this process, I found that the feedback I was getting is that librarians really wanted to be helpful, that they were trying to help people with all these social servicey kind of needs, because that's just, they saw the need and wanted to be able to respond, but didn't have as much expertise as was really valuable, as well as detracting from the other more typical librarian type duties.
That makes a lot of sense.
I will echo that on the expertise. So we have amazing research staff. I work with amazing librarians over the years. But there's a certain expertise, but there's a certain knowledge, and there's a certain level of connection that for us a case manager brings. So an example, Deborah, as our case manager, was working at one location. She got a call from another branch that they had a customer who was acting a little erratically. Could she come over? And she was pretty close. So she drove over. She talked with the person. She diagnosed for that because she could, and she had the training to recognize that and ask questions and find out that this person was off their medication. They were suicidal. They were having there was a lot going on. So she had the library staff call 911 and call IMSA. IMSA came, and Deborah was able to show her ID, which is Family and Children's Services. They took her off to one side, and she was able to tell them, this is what's going on with this person, and this is the next step I think you need to take. If we hadn't had a Deborah, if the library manager had been the only person dealing with that customer, we probably would have just called 911 and the police and had the police come and get them. And with Deborah's expertise in coming in, she was able to actually take a situation and move that individual to a service that was going to help them and a little quicker. Or if that person had even told the manager, hey, I'm suicidal, if the manager had told that to the medical technicians, they would have been like, okay, well, tell us exactly what, but not the credibility. He would have had the credibility that Deborah had because she has the knowledge and background and training. So it's that connection with the other agencies where Deborah can actually help make those connections a little better than library staff can when there's a crisis situation in particular.
Right, that makes a lot of sense. I can definitely see situations just in my experience where it would have been helpful to have someone that knew. I mean, there's always a worry that you're crossing privacy concerns also, and having someone that is trained to know when it's appropriate to cross. I could see that being very helpful. My only other question was, how in your experience has this worked with library security? Has library security also been able to have the special training that staff have gotten from your social services or case manager workers in your libraries? And have they been able to work fairly well together?
Yeah, so our case manager, when the program first started, because Deborah wasn't our original case manager, one of the first pieces was to get that case manager involved with security team, talking with them, in fact shadowing with them in their walkthroughs the library and as they engage with customers. And they know, like the position started at Central Library, and they knew all the people at Central to sort of introduce her to she could see how they talked with them. So, but she's also recognized over the years we've brought in more security staff across our system. That department has gotten larger. She has observed them and their engagement interactions with customers as much as she has the frontline library staff. And she's gone to their security supervisor and said, hey, this person needs to come to training. We need to correct a little bit of how they're engaging with customers, because our security team is there to make sure it's a safe environment for everyone. So they work very much hand in hand. There's a lot of conversations between them. In fact, when her schedule goes out, then they're one of the groups that gets a copy of the schedule. They know how to contact her. They know her phone numbers, etc. She also knows what their role is. So she knows how they work and what they can help her with. When she sees a need, it may be, you need to call security. This is not a situation that a case manager is going to help with. She can also connect branch staff who may ask her questions and say, that's really going to be someone from security you need to talk to, and here's who you should talk to. So it's very much a good partnership, a lot of conversation. And I think across the system, you can never, you have to continuously keep those relationship building activities going on, because we have new staff all the time, in and out, in and out. So
Yeah, let me echo what Sue Ann said as well. I think that is just a critical relationship between the social worker and the security staff. Because, one of the mantras of social work is safety first. So, without a safe environment, nothing else is going to work. And on the other hand, it needs to be an appropriately safe setting as well, to be sure that the safety aspect is being done correctly, and that some mental health or social service training can be an asset there. But that partnership is just critical for the social worker with security staff.
And I'll also say that it's important if you embed someone or you're in partner with another agency, that they understand your library policies. What are your expectations of customers? What are your expectations of the staff? What are your policies about someone coming in and lighting up a cigarette in the library? What are your policies about eating or drinking in the library? It's important for whoever you bring in to work with you, if they're going to be there for any amount of time, that they understand the work environment from the library perspective as much as they bring in their own expertise. So it's definitely a two-way street. Even if you have those students come in and do their practicum, they can't just come in and sit down and start working. They've got to have understanding of what the library offers and how they work. And if they understand what services and resources the library has in the building there, then they're able to even connect the people they're working with, the library users are working with, maybe more closely with something. We can't expect ever that people know public libraries offer free computers and free Wi-Fi. So it's training. Deborah, for example, does a lot of training for our staff, but she's actually had a lot of training herself on library resources, which makes her feel more confident and comfortable what she's doing.
All right. Thank you guys so much. Any final thoughts?
Baby steps. You're not going to start out. I said over 8 years that we've been in this partnership with Family and Children's Services, and it really kind of started a little bit working with Greer many years before that, of recognizing having some expertise come in was great. So don't feel like you have to just jump in whole hog. Start looking at what's going on in your own community. What are some opportunities? Start talking with folks. Start talking with stakeholders about, hey, here's some concerns, here's some needs. Who do you know? What do you know? What are resources? So just, it's not full hog. You don't have to jump in.
Right. Yeah. I'd say, identify what your local resources are and start to develop relationships there.
Great. And it's really exciting to see that ODL has collected all of these resources for us. That's going to be a really great first step, is to check out that website.
Yeah, it's a good website.
Agreed.
All right.
And of course, you can contact any of us if you have additional questions or concerns or ideas, or you want to run something by any of us. There is our contact information. Please reach out.
Yes, please do. Thanks again, Wendy, Greer, Sue Ann, you guys have been wonderful. Like I said, this is great information, definitely very much needed. Thanks for everyone who's joining us, watching this recording. I would encourage you to consider joining the Equity, Diversity, Inclusion, and Intellectual Freedom Roundtable. We're going to do a lot more on this topic and other topics throughout this next coming year. Please remember to complete your session evaluation on the OLA Conference app, and we hope you'll join us for many more sessions. Thank you.
Thanks.
Thank you.
Guys.